Hello guys, welcome back to my YouTube channel Knowledge is Power. Today we'll be discussing about the mechanical ventilation. So today's contents will cover up about the mechanical ventilation, the different types of mechanical ventilation, indication of mechanical ventilation, and at last I will discuss about the modes of ventilation. In medicine, mechanical ventilation is a method for mechanically assisting or replacement of spontaneous breathing. It is used in the ICUs for short period of time during a serious illness. Now, I would like to talk about the different types of mechanical ventilation. Negative pressure ventilation, positive pressure ventilation. Under positive pressure ventilation, two types, invasive and non-invasive types of mechanical ventilation. First, I would like to talk about negative pressure ventilation. So, negative pressure ventilation, it stimulates natural lung movements. It does not require tracheal intubation and may reduce the incidence of barotrauma and the adverse effects of the cardiovascular system. Negative pressure ventilation is also known as iron lung ventilators, where just the patient head remains outside the whole body chamber, have saved the lives of many thousands of patients with the problem of pneumonia and other lung diseases. Now, I would like to talk about the positive pressure ventilation. In the diagram showing the positive pressure ventilation, positive pressure ventilation is a form of respiratory therapy that involves the delivery of air or a mixture of oxygen combined with other gases by positive pressure into the lungs. Positive pressure ventilation describes the process of either using a mask or commonly a ventilator to deliver breaths and to decrease the work of breathing in a critically ill patient. Now I would like to explain about the different indication of mechanical ventilation. Inadequate oxygen. If a person is having acute hypoxemia, it may be results due to atelectasis or any kind of airway obstruction. Then inadequate ventilation, it may lead to acute hypercapnia, that is the excess level of carbon dioxide, which may lead to obstructive lung diseases like asthma. Apart from that, if a person is having any kind of lung diseases or if a person is unable to ventilate of their own or sometime due to trauma, any kind of accident, if there is any kind of injury of brain, then a person can undergo for mechanical ventilation depending upon the condition of the patient or the severity of the patient. Now, I would like to say about the criteria for institution of ventilatory support. In the diagram showing the different parameters like arterial blood gases, a person must have PHC that is less than 7.25 and the normal range is 7.35 to 7.45. Then, if a person is having partial pressure of oxygen less than 60, then in that cases a person may undergo for mechanical ventilation. Then, in case of the partial pressure of carbon dioxide, if a person is having greater than 50 mm of Hg pressure. Also, another parameter like pulmonary function studies, if a person is having respiratory rate greater than 35 breaths, if a person is having tidal volume that is less than 5 ml per kg body weight, if the vital capacity of the person is less than 15 ml per kg body weight, if a person is having maximum inspiratory force less than or equal to 20, in all these cases, a person may need mechanical ventilation. Now, I would like to talk about the different modes of ventilation. Now, I would like to talk about the different modes of ventilation. There are three different modes of ventilation: control mode, supported mode, and the last one is the combined mode. Under the control mode, there are two modes of ventilation. One is the pressure control mode, secondly is the volume control mode. Under the supported mode, continuous positive airway pressure, also known as the CPAP mode. Then comes the pressure support mode, and in the combined mode, there are two types, that is SIMV mode with the combination of pressure support and SIMV mode volume control mode togetherly with the pressure support mode. The full form of SIMV mode is synchronized intermittent mandatory ventilation. Now let us know about the control mode in a brief way. Control mode, it delivers preset volumes at a preset rate and a preset flow rate, and here a patient cannot generate spontaneous breath, volume, or flow rates in this mode. Now I would like to talk about assist control ventilation mode. In here, if the patient does not initiate inspiration, the ventilator automatically delivers the preset rate and tidal volume, ensuring minimum minute ventilation. In assist control mode, the work of breathing is reduced to the amount of inspiration needed to trigger the inspiratory cycle of the machine. This is the chart showing the different modes of ventilation: control assist control mode, SIMV mode, support mode, as well as all the different targets and the different indications of different modes are also shown in this chart. Now I would like to discuss about the CPAP mode and the Bipep mode. CPAP, it stands for continuous positive airway pressure. It delivers air pressure at a single level. Now talking about the Bipep mode of ventilation, the Bipep, which stands for bilevel positive airway pressure, it changes the pressure as per the breathing pattern, making it easier for the person to breathe. Bipep refers to bilevel or two-level positive airway pressure. It delivers both an inhalation as well as exhalation pressure. These two pressure are also called as inhalation positive airway pressure and exhalation positive airway pressure. This is the diagram showing the CPAP therapy as well as the diagram showing the BiPAP therapy. Hope you all guys got brief idea regarding the basics of mechanical ventilation. We have learned about the different indication of mechanical ventilation, about the types and the different modes. Also we have discussed about the different criteria in order to ventilate a patient. So for more such useful videos related to all the medical topics, please like, share and subscribe my YouTube channel, and don't forget to give the valuable feedback and suggestion if needed. So thank you and have a nice day ahead.